Hello, everybody. My name is Dave, and today I am doing my presentation on cerebral palsy. And cerebral palsy, you may ask, is defined as a group of permanent disorders of the development of movement and posture, causing activity limitation that are attributed to non-progressive disturbances that occurred in the developing fetal or infant brain. So really, it's mainly like an abnormality that may happen during brain development as a fetus, and it may also happen within the first couple years after birth due to a traumatic injury to the brain. And again, this injury or abnormal brain develop affects many different health functions and things like that, and I will get into that later, of course. So really, cerebral palsy is not one disorder, but several that are linked to the timing of disturbances to the brain. Again, those abnormal brain development or injuries, and it results in permanent motor disorders and many other health complications, as I mentioned, including, disturbances of sensation, perception, cognition, communication, behavior, epilepsy, and many different things. So what is the prevalence of cerebral palsy? Well, according to Ehrman et al., it happens every 2.11 to 1,000 births. Greatest risk is in infants born at less than 28 weeks of pregnancy and at a birth weight of 1,000 to 1,499 grams. So really what we're talking about here is premature birth, not giving the fetus enough time, to develop properly. And so vice versa, the lowest risk is in infants born after 36 weeks of pregnancy and at a normal birth weight of 2,500 grams. Other risk factors include hyperbilirubinemia, an increase of bilirubin in the blood, bilirubin being a substance that is produced when red blood cells are broken down. There's also infection of the fetus or mother, trauma during birth, intracranial hemorrhage, i.e. bleeding inside the skull, and lower socioeconomic status, traumatic head injury, tumor, and anoxia as a result of drowning. So the pathophysiology behind it, 90% of cases with cerebral palsy was the result of noxious events leading to damage of the brain tissue, while the other 10% were due to abnormal brain development. So most of these things are happening due to a traumatic injury or, toxicity, whether it be, due to a result of a lack of oxygen and things like that. And type and location of the neurologic abnormalities and lesions leading to the cerebral palsy will depend on the timing of these noxious events. So brain malformations are often related to events before 20 weeks, as this is when the brain structure is forming. White matter damage results in events from 26 to 32 weeks, and complications at the end of the third trimester will affect gray matter development. So what are these health complications that we were talking about? Well, patients usually demonstrate muscle weakness as a due to motor control issues, and in part due to cellular changes such as smaller muscles. Again, these muscles affected depend on location of brain lesions. Muscles in cerebral palsy also appear to have a blunted response along bone growth. Thus, contractures, stiffening of muscles, and joints can develop. And finally, these conditions will worsen over time, so much that by the age of 25, studies show 75% of people stop walking completely. This is by Murphy and et al. So it's a really serious disorder and complication, and physical activity and intensive treatment will really help. Again, I will get into that later. A couple more health complications are pain, often association with this population, and again, that's a reason that patients usually have trouble adhering to exercise programs. And then finally, you also have intellectual disability, sensory deficits, seizure disorders, emotional problems. All type of complications can arise due to these abnormal brain developments or traumatic injuries. So how do these complications affect training? As you can see from this chart right here, the musculoskeletal problems, things such as hip dislocation, pelvic obliquities, bone loss, really don't have an effect on attempting as best as possible to avoid weight-bearing exercise. So this might include, recumbent bites, recumbent steppers, anything where the patient's not, putting too much stress on these joints. Other problems may include, cognitive or behavioral, complications. So, the person may not be able to keep up with you as well. So, speak slowly, allow adequate time for response, take into account any seizures or medications, any sensory or perception impairments. So, make sure that you're really taking the time to break down these instruction and cues when you're working out with your client. So looking back at the treatment, again, as I mentioned earlier, it's very intensive in childhood, and a lot of things are carried over into adulthood, but not all medications are. Treatment is multi-focused, of course, and involves, drug therapy and exercise interventions heavily. Some examples of primary medications include anticonvulsants for seizures, botulinum toxin ingestions for spasticity being random contractions of different muscles, and anticholinergics to reduce dystonia and drooling. And then finally, some other treatment includes casting and surgery for contractures, manual and occupational therapy for motor activities, and muscle stimulation. So again, looking at some of the different drugs, as you can see from this chart here, for anti-seizure, we can use a couple different things. Phenobarbital, phenytoin as well. And then you also have some antispasmodics to reduce this spasticity that you often see with this population group, Valium and clonidine as well. Now, in terms of the exercise prescription, again, this is taken straight from clinical exercise physiology. Aerobic exercise should start off at moderate intensities and include large muscle groups. So pretty standard with any, population. Always look to work the large muscle groups and, start off at a light to moderate intensity. Some considerations to include are proper postural support, because again, these people usually have, poor motor control, footwear, and also weight bearing or bone issues. Again, these people may have, poor bone development, a lot of hip fractures and things like that. So putting stress on these joints is not usually a good thing to do. In terms of resistance exercise, should start off at high volumes and low intensities. Again, a characteristic of, most populations and healthy populations at that. Now, a big thing with this population is maybe to incorporate elastic bands and machines as needed, only because they have poor motor control. And I know as, an exercise science student, we often learn that machines aren't the best things to use because they don't allow you to develop motor control. But again, the goal here is not to be subject to this motor control for this population. It is to, prevent, decreases in muscle strength for these individuals. So machines may actually be a good, type of exercise to use for them. And then finally, in terms of flexibility and range of motion, the goal should be to maintain flexibility, as range of motion specifically isn't improved in this population. So we are just going to try to maintain what we have. So again, cardiorespiratory, we're going to work from 2 to 5 days a week, pretty standard. Resistance, 2 to 3 days per week. Again, very standard with all populations. And then range of motion, the normal 30 to 60 seconds per joint. And, doing that as many times as possible per week. Minimally, I would say about 3 to 7 days per week. And then I have some references for you guys that I will go back to in a little bit. So looking at our case study that I presented here for you guys today, we have a 20-year-old male with cerebral palsy, 90 kilograms, 165 centimeters in height, BMI of 32.9, blood pressure of 132/90, LDL over 140. A couple of medications that this person has taken are antispasmodics and anticholinergics. And the goal, again, is to increase muscular strength, to lose weight, and improve blood lipid levels. Some risk factors that, as you may have already noticed are, blood lipid levels. We have very high LDLs. And also obesity, a BMI of 32.9. And something I didn't write down here, but as you can tell, this person also has stage 1 hypertension. So again, if we were to set up a sample exercise prescription, again, looking at our chart right here, we might put this person on, a 3 to 4 day per week program initially, again, at moderate intensity to attempt to lose some of this weight and attempt to improve these blood lipid and, hypertension levels. And resistance training, again, we'll probably start off with like 3 days per week, maybe do an upper lower body split. Keeping in mind that this person might need postural support, and we might, have them, hooked up to a harness or up against a wall under close supervision, and allow them to get the needed exercise that they need. Some special considerations with this group is a low energy output. So again, this is why we start at low intensities or bursts. And again, as I mentioned, many times, poor motor control. So, use recumbent stepping or cycle hand ergometers, something that will allow them to not have to balance themselves. Continuously ask patients how comfortable they are to avoid increases in muscle tone. This is referring back to the spasticity as I was talking about. So to avoid, random contractions, we need to make sure that these people are in a comfortable position. Use relaxation and stretching techniques throughout the session. Again, another way to reduce spasticity. And make sure the head, trunk, and proximal joints are in good positioning. And finally, before initiating exercises with dumbbells, make certain the individual has adequate motor control. So again, always a big consideration is their motor control and if they're able to balance themselves properly. So this was my presentation that I put forth for you guys today. If you have any questions, I would definitely recommend reading the related material in the ACSM book and also clinical exercise physiology test book that we have for this class. And finally, there's plenty of research out there on cerebral palsy, so I always recommend taking a look if you're more interested. And thanks a lot for tuning in. Again, my name is Dave, and have a good one.